In medical news, a major health warning for men. Testosterone treatments are widely used and they are heavily marketed. Well, now a major study has found that they may increase your risk of heart attack or stroke. Dr. John LaPook has the details.
When restaurant owner Luca Marcata started feeling tired, he asked his doctor to check his testosterone level.
I did not have energy right in the morning. You know, in my business, you have to go and go and go and go.
His levels were low, and his physician prescribed a gel containing testosterone.
And now I feel the way I should be feeling.
Low testosterone levels are linked to problems like fatigue, muscle and bone loss, and decreased libido. While replacement therapy is FDA approved for some conditions, it's widely marketed as a way to improve health and stay young. But there's little data on its long-term effects. The study looked at older men, most with heart disease, who had low testosterone levels. There was a 29% increased risk of heart attack, stroke, or death in those given testosterone. Cardiologist Dr. Steve Nissen of the Cleveland Clinic says we need better studies to assess the benefits and risks of testosterone therapy.
Just like women go through menopause, men go through menopause. And that's probably a normal part of male aging. And treating it as a disease may get us in a lot of trouble.
Urologist Dr. Elizabeth Cavalier says the decision to prescribe testosterone is complicated.
There are risks that are associated with having low testosterone, and there are risks associated with testosterone replacement.
Before you start treating millions of Americans with testosterone, you probably ought to think twice.
There are several possible ways testosterone replacement might raise the risk of cardiovascular disease. Research suggests it might increase the likelihood of clotting within arteries. Further study of the risks and benefits is clearly needed. Dr. John LaPook, CBS News, New York.
And Dr. Michael Ho is an assistant professor of medicine at the University of Colorado, Denver, and the senior author of the study. Good morning, Dr. Michael Ho. Thanks for joining us.
Good morning. Thank you for having me.
So first question for you. You're one of the authors of the study. Were you surprised by the results?
No. I mean, we went into the study thinking that there may be an increased risk associated with testosterone therapy. What was interesting about our results was that the findings were consistent in terms of the risk for patients with underlying heart disease and those without heart disease after their coronary angiography.
Testosterone is approved by the Food and Drug Administration. Do you think that doctors and patients have enough talk, though? Do you think they talk enough about the benefits and risks when doctors are considering prescribing it to their patients?
Yeah, I can't say in each situation, but I think prior to our study, there was not a lot of studies that looked at long-term cardiovascular effects. And hopefully with the results of this study, it may help inform that discussion between patients and their physicians.
More and more, I think over the past few years, we've seen now commercials for testosterone, the gel, the patch, and people use it for all sorts of things, whether it's fatigue or low sex drive and all those sorts of, illnesses, if you want to call them that. Who really should be getting testosterone?
Yeah, according to the Endocrine Society guidelines, I mean, it's generally recommended for patients with, testosterone levels of less than 300 and symptoms. And some even recommend a testosterone level of less than 200 and symptoms to be treated with testosterone therapy.
So you have to have both, the symptoms and the low level. If you're not feeling bad, there's no need to have any sort of prescribed testosterone.
It's not generally recommended according to the guidelines.
So what if you're a man who is taking testosterone now and you read about this study? Should you panic?
Yeah, I mean, I don't think you should panic. I mean, the study suggests that there may be an increased risk, and I think this should hopefully inform a more open discussion between the patient and their physician about kind of the benefits of the therapy versus any potential risks.
Yeah,
and then they should, decide on that whether to continue therapy or start therapy.
Are you hoping that this study will hopefully lead to more studies of taking a look at testosterone and its risks and benefits?
Yes, definitely. Hopefully this will kind of start the discussion and more studies to look at whether, what are the benefits and the risks of testosterone therapy in, a different population of patients.
Well, it's always good to have more information and be more informed. Dr. Michael Ho, Assistant Professor of Medicine at the University of Colorado, Denver, thank you so much for joining us this morning.
Great, thank you.